In today's episode, we're diving into the art and science of face reflexology. If you've ever been curious about how the face can be a map to our internal health or how a gentle touch can promote deep healing, please keep watching. Joining me today, Iman Al-Awadi, a certified face reflexologist with experience in helping people find balance and relief through this powerful technique. We'll explore what facial reflexology really is, how it works, the science behind it, and how it might support both physical and emotional wellness. Good morning, Iman.
Hi, good
Lovely
morning.
to see you in person. We had a great talk before shooting this.
Yeah,
So I would like to first ask you, how did you discover this profession or this practice?
so facial
Yeah,
reflexology.
facial reflexology.
Okay,
So people can know what is it or how did you
yeah,
find it? Yeah.
absolutely. I actually discovered it trying to. So I was doing a hormone course before this profession that I'm in now. And I really wanted to give people, I said, I just need something else to offer them that they can then have the tool in their hands to fast track their healing process.
Mm-hmm.
And I was like, there's so many times where we often put that power in other people's hands and not in our own. And I just felt like it was so important to give them something they could do to regulate themselves.
Mm-hmm.
And that's when I kind of stumbled upon facial reflexology. I was looking at acupressure, I was looking at acupuncture, but I was like, all of these things, acupressure, fine, and we still integrate that.
Yeah.
But like acupuncture, you need someone to do it on you. But facial reflexology, it's traditionally used in the Vietnamese War when they didn't have enough acupuncture needles to go around. And so they would teach people how to stimulate these different reflex zones on their face to fast track the healing process.
Mm-hmm.
I was like, well, that's perfect.
Okay.
So I started integrating it myself.
So did you know about this before you dug into it, or you just
No,
you
I knew about reflexology and I loved that. And I think that's kind of what I was searching for. But to hear the facial part of it, I thought that was great because especially for women,
Yeah.
it's closer to the brain. We're really working via the nervous system here.
Yeah.
And when it comes to hormones, just anything to bring the cortisol levels, regulated and everything.
Can you explain what is a facial reflexology so people can relate to what we're going to talk about?
Yeah, sure. So facial reflexology, it's rooted in traditional Chinese medicine and Vietnamese medicine as well.
So it goes way back.
It goes way back. Yeah. And a lot of the principles are shared upon with acupuncture and acupressure.
Okay.
But basically the concept is that you work predominantly on your face and you have different reflex points on the face. And so when you stimulate that reflex points, it creates this response in the certain organ or the system that you're working on.
Mm-hmm.
And what's amazing is that initially it was built this way, where certain parts that look the same, it's a theory that they have, is certain parts that look the same are connected on the face. So for example, the area of your eyes, they're your eyes as well. So we'd work on that. But then it's also responds to the breasts, the ovaries, and also the testicles when it comes to men as well.
Interesting.
So it's just things that look similar will be part of the same reflex points.
Okay. How does it differ from like the foot and the hand reflexology? So is it the same concept?
Similar concept in the sense that we're still working on that relaxation and bringing you out of like a fight or flight freeze sort of state of mind and very regulated. But where the hands and the feet, you have one point is related to one part of the body. So for example,
is what though?
Like your big toe would be responsive to your head. So if you have a headache, they say, press your big toe and then release it and your headache will go sort of thing.
Okay.
Whereas with the face, one point can mean various parts. So like I said, the eyes would be also the breasts.
Okay.
So we work on that with breast cancer patients as well, just to really get more of the disharmony moving from that area of the body.
Okay.
Yeah.
Would you mind getting exactly deep into each part of the face? That what is it related to?
Sure. So like different points?
Yeah, different points.
Yeah. So we've got the main part, I think that's really helps most people is the part in between your forehead. So this area here, that's your main area. If you stimulate it, I'd say 20 circles at night, you're going to fast track your sleep process.
Okay.
You won't fall asleep right away, but you will have the best night's sleep after that. It's
So it
also
gets your nervous system down.
completely regulates your nervous
Okay.
system. Yeah. And it's just a very relaxing point. And sometimes you might even do this unknowingly. And that's how intuitive the body can be,
Mm-hmm.
is when you're really stressed or you're at work and you're just like this.
Ah,
And it's
yeah.
just that you kind of know intuitively where you need to stimulate.
Interesting. Yeah.
And so it also corresponds to the liver. So
Okay.
something that's really interesting is when we have our frown lines,
Mm-hmm.
and that's located over the liver. But in traditional Chinese medicine, the liver houses the emotions of anger and irritability and frustration.
Mm-hmm.
So when we're doing this, we are showing on our liver that those
Okay.
feelings of the
Ye-
anger and the frustration and stuff.
Okay. Okay.
So it's very interesting in that sense. We have another point, which is right here. So under the cheek of the left side is your stomach. So if you're ever struggling with bloating or constipation or any sort of stomach irregularities, especially for kids, this works marvelously,
Nice.
is stimulating this point as well.
Okay. Interesting.
Yeah.
So let's say if someone has, like you said, bloating issues, digestion. So would you say this cures?
Definitely not.
Okay.
I think I'm from the kind of theory that if someone is telling you that one thing is going to fix everything,
Yeah.
they're blatantly lying to you. The thing about reflexology and facial reflexology is it's a complementary therapy. So, for example, with my own history with it, I was fixing nutrition, trying to heal myself. For context, I struggle with PCOS, I struggle with IBS and OCD and anxiety.
Okay.
There's a whole list, which is
Okay.
really
So maybe that's
fun.
the reason that you got into this whole thing.
Yeah, definitely.
Yeah.
Yeah, for sure. That's the reason why I started that course, which
The
is when I
hormone.
was looking
Yes.
for, we go back.
Okay.
And it was to regulate myself. And then once I figured these things out, I wanted to help other people like me.
Mm-hmm.
That, again, we're placing power into other people's hands.
Yeah.
When it's like, actually, if you just go back to the basics and deal with your food and your movement, and then, there's this spare thing happening here we don't take account of, which is that reset button. Because that's what I was finding is when I was working on nutrition, I felt great. I'm very much a food is medicine type of person. And I've seen the benefits of that, skin clearing up and IBS completely improving.
Mm-hmm.
Movement as well, facilitating all of that, feeling stronger and better in your mind and your body. But then it just didn't feel fast enough, and like it was a little slower than it should have been. And that's where that dysregulated nervous system was holding me back.
Yeah.
And so facial reflexology is my tool for that.
Okay. If you don't mind me asking,
Yeah.
so when did you get diagnosed with PCOS
PCOS?
and IBS?
Yeah, at about 14. IBS, we go way back.
Okay.
That's something I grew up with, and very much anxiety-based IBS, which in most cases is a thing for a lot of people. So now, knowing what I know with traditional Chinese medicine, when we look at the stomach or any issues of the intestine, it's usually always linked to the lungs as well.
Mm-hmm.
So there are certain sister organs that work together.
Okay.
And that is something that and we know this as well with like the vagus nerve. And when we talk about the stomach as our second brain, this is what we're talking about with facial reflexology as well.
The gut connection brain. Yeah.
Gut connection.
Yes. Yes.
And so struggling as a kid with anxiety, but then that manifesting as stomach issues was very much a real loop that I was stuck in.
Okay.
So, and some parents might resonate with this. A lot of kids on the way to school might come up last minute, maybe 10 minutes before they actually arrive to school, where they say they have a stomach issue.
Yeah.
Or I don't feel well. Or all of a sudden they just don't feel well. And in a lot of cases, you might think you're fine. It's in your head.
You're just like anxious to go.
Yeah, you're just making it up.
Yeah.
And that might be true in a lot of cases where it's starting in your mind. Not necessarily that you're making it up, but actually the anxiety is there. So the mental part is there. And then it's manifesting itself as a physical issue.
Okay. Before we get into details, the science behind it, so since you mentioned about you were diagnosed with PCOS, so since you were 14, so what, if you don't mind sharing that experience, and how did you regulate your hormones, or how did you manage? Were you on birth control, or when did you find out that nutrition is a big part of
Yeah.
trying to, let's say, not cure it, but manage the symptoms that you have?
Yeah.
So
Yeah.
how did you find this relating to that, and how did you fix everything with your symptoms?
Well, like most things, it was really a long journey.
Yeah.
And that's, I think the misconception is you're going to just do some change and then it's all going to be better.
Mm-hmm.
And that was one thing that I struggled with as well. I was like, I'm fixing these things. Why am I not getting better? But with PCOS, they told me I was mainly like high testosterone PCOS at 14. And, you know, the
And
doctor...
you just started your period.
Yeah, pretty much. So
Yeah.
instead of saying, let's just wait it out and let's see if it regulates itself, or let's try doing these certain things, maybe work on your mental health, or maybe just exercise or eat better. Because, I mean, I would
You're
call
14.
up... I was
You're
14. I was calling up KFC and they knew my order before I told them who I am. Like,
Okay.
we were at that
Yeah,
relationship.
yeah.
So food was not good. And so instead of telling me to do those sorts of things, she gave me this beautiful packaged solution of birth control.
While you were 14.
When I'm 14, like, why would I need birth control
Yeah.
at 14? And that's something that so many kids are
Were
having
you
to
struggling
face.
with your period, though?
Yes. Yeah. They would be completely irregular. So I'd
Irregular.
have like 3 months where I would have a consistent period on and off for 3 months, which was not normal and not fun to experience. And then have 2 months of nothing.
Okay.
So that up and down for my mood, for everyone around me,
True.
was not fun.
Yeah. So you decided to take on that birth control.
Yeah. So I never thought to inquire, and no one else thought to inquire
Yes.
at the time
And
because
yeah, back then I don't think it was so.
yeah,
We're so much aware of the
yeah.
side effects of birth
Well, you
control.
also don't ask too much.
Yeah, you're like,
right?
okay, yeah, I need this, I'll take
The
it.
doctor told me to. I will.
Exactly.
So
Yeah,
that's kind of what happened, and then I took that for 10 years.
10 years.
Yes.
So until you're like, let's say 24.
Yes. So everything was perfect.
Consistent 10 years.
Yes.
Okay.
And I had no idea.
How was the journey you taking it? Did your period got regulated? Your symptoms got better?
Well, everything pretty much fixed, right? Or
Yeah.
so I thought. Band-Aid fix. Because I had no acne. The kind of excess hair growth was regulated. So I was like, yes, it's only on my head, which is where we want it to be.
Yeah.
And the periods were regulated. Well, that's what I thought until I discovered later on that it was never really a real period, right? It's like a phantom, forced period that you get just to convince yourself that it's all working in the brain. But it's not a real bleed because you're never ovulating. So that whole process is a little bit of a sham, unfortunately, but it's still happening. And I didn't think any better of it.
So in 10 years, you did not have the curiosity to get into it?
No, because
Never.
I was at uni.
Yeah.
And
too busy with life, and you did not even think about
exactly
what would,
And I almost didn't want to because I felt like I'd be opening Pandora's box. So there was a lot of just sweep it under the rug with me at that period of time. And it wasn't until I started eating better.
How did you discover that food is related to that?
So I ended up developing allergies 2 years in to university. No idea why. I'd never struggled with this before, but it was something new that started coming about. And I feel like the universe, or whatever it is, your body has very funny ways of making you see things you don't want to see. And that was something I feel like was another cry out, like, you're hiding from us. Let's do something about it. So with the allergies, I was like, okay, fine, let's do Band-Aids again. I was taking Atrovine and I was taking decongestants daily. And on the days where I didn't take them, I was really struggling. But then it got to the point where I was so used to them that they weren't working anymore. So I was on them for like another year. And I went to a yoga class. I was at uni, so I was looking at different fun things to do. I heard of yoga. I got my leggings. I went to yoga.
Okay.
And at the time, that was my idea of yoga. And that was when my yoga teacher over time discovered, and I was telling her, like, is this normal? Have you heard of this? Because I started seeing her as someone who really knew what she was talking about. She was a look of health and wellness. And I was like, you seem like you know things. I'm not getting the answers I need from other places. So she was like, try quitting dairy just for 2 weeks and test it out. So I was like, okay. So I quit dairy for 2 weeks and I could breathe. I could actually smell things again for the first time.
And that's just a simple cut off in your
That
life.
was one simple thing, I mean, over time and over the years, I obviously quit my relationship with fast food just from growing, but I wasn't doing these other big things. So I ended up completely ditching dairy. Best thing I've done. And I was like, okay, slowly it snowballed into a big, I think these things usually do. You find another thing that is really good and you try it out, and some things might stick and some things might not. For me, it all seemed to be really helpful. And although I was fixing my PCOS, my stomach issues were still on and off all the time. My anxiety was still on and off all the time.
Okay.
So that was only one aspect that I think I had under control. And yeah, it is a long story.
It's okay. I'm so interested. If you're fine talking about this, I'm just.
It's a long story.
I feel like it's gonna be an eye opening for so many people that are struggling with this.
Yeah.
Yeah, I do understand that 14 years ago, or like 20 years ago, is completely different than what we are now. But unfortunately, people are still having the same issues with going on birth control at a young age without seeing those kind of things, the food, the lifestyle, the sleep pattern, the bad habits that they're doing that's affecting this.
What's happening.
And yeah, it's the PCOS is like every household you go in and you see like a girl has period issues or hormonal issues.
It's shocking.
It is. And it's the main thing is related to lifestyle. And it's not very much talked about that the lifestyle has a huge impact on this.
Yeah, absolutely.
Yeah.
It was huge.
Yeah.
And honestly.
And when you went off the birth, are you off the birth control?
Yes. Yeah.
So did you feel the difference of getting off
completely
with the mood, the anxiety and sleep, anything?
It was a roller coaster. Yeah, complete roller coaster.
I know so many women that were on birth control for this long.
Yeah.
And they thought that was them.
Yeah.
Yeah, the anger, like this, how they deal with things. And that was their personality. When they went off of it, they realized, oh my God, this is the actual me. And the birth control was taking over their emotions.
Well, it's funny because I know a lot of my clients are those people. But then I've actually met a lot of people that were like me, and I think it depends on your symptoms.
Okay.
If you go on birth control for simpler issues or symptoms that aren't quite as bad, I find that birth control does not agree with your body, right? So you're saying like these ladies, they had mood swings, they gained weight, or there's like their body was rejecting it. My body was accepting it.
Okay.
Yeah, and there's other people like that where it was like, actually, I was glowing. Things started feeling better. But again, I was 14. So then fast forward to when I actually finally decided to get rid of it. Because I was like, you know what? My nutrition, we're here. I think I'm happy with it. And I think I can handle this healing phase. And I was under no, I knew that this was going to be a process. I was reading up on things. I was getting more educated and all these things. But I was like, I think this needs to be done. It's the final Band-Aid removal. Let's go for it. Dive in. And that's when everything just unleashed.
Yes.
The acne was everywhere. It was down the neck. It was chest. It was everywhere.
Okay.
And it was angry. And I was like, okay, it was very difficult in that phase to be very patient with myself and not try and cover it up as much as I really wanted to. I was like, okay, no, you're here. I get it. This is 10 years worth. I cannot expect to get out of this in 2 months. I've put you through this for 10 years. I wouldn't be surprised if it took 10 years to get out, but thankfully I'm doing all the right things that I'm hoping to take that 10 years recovery and make it 1 year.
Oh, yeah.
You know?
At least half of it, yeah.
Yeah.
Okay.
So, and that's what happened.
Okay.
In a year, a roller coaster emotionally in many ways. And I'm sure that a lot of women who have come off of birth control have seen that.
Yes.
But when you're out of it, you're like, oh my gosh, I feel so much lighter, you know, and I feel in control of things. And it's so nice to have a proper working period with a proper ovulation process and have your body working in that way and actually be able to develop that language with your body, knowing what the cues mean and knowing how to interpret it. You know, if you're late, why was that?
Yeah,
you know?
getting in depth about why.
Yeah,
Asking the question.
inquiring.
Yeah.
So definitely.
Okay, back to our
Yes.
main topic.
Oh yes, facial reflexology.
Okay, so I want to ask about what kind of transformation you saw with a specific client in terms of what she was like having, symptoms or any issues that she would have, and how did this, I wouldn't say, heal it. Let's call it healing what you have. So can you share a transformation with a client?
Yeah, I mean, what's beautiful about this practice is it's allowed me to have clients of all ages. And if I try and think of one client in specific, it's really difficult, but I'll give you a couple.
Sure. We have all day.
Yeah, I've got my eldest client is 85 and my youngest is 5.
Whoa, nice.
Yeah, and I have a 12-year-old girl who is really struggling, flare-ups with sinus issues. And so any miniature like change in weather, and as you know, it can get really dusty here, she would have a really bad flare-up. And I mean like 2 weeks where she'd go to school and struggle. So just working on the facial reflexology to relax her, to also work on, like we said about the lungs and the stomach being connected, we're working on the lungs to bring in the new and the intestines to release the old. And she's completely fine now. And to the point where, again, as a self-regulation tool, yes, I've told her to implement certain lifestyle changes because it's a complementary therapy.
Course.
But she also knows how to use certain points herself and help herself.
Okay, so I was going to ask this question. Yeah, so
at
you can
12.
you can do this by yourself.
Yes.
So it's the same concept of
Yes.
Yeah, I wanted to ask something. So you know the energy and all the when someone touches you, it makes a huge difference with their energy. So is this related to the energy of someone else touching those points and healing those kind of specific things, or it doesn't have to do anything with that, or I can do it with my own hands or the tool itself and I can have the same effect?
Yes, I think you can definitely do that. It's always nicer because I think more than anything, not necessarily the science, but just the association we have. We like getting massages.
Yeah.
And instantly, when you're going to get a treatment, for most people anyway, you go into a certain state. And so getting this as a treatment is always really nice. And almost the transformation happens more instantly. But in a lot of cases, and in most cases, you can just do it on yourself. But I think more than the energy itself, it's the intention. So when I'm working on a client, my intention is to really direct the energy to these areas and start healing process in that way. But also my intention is for them, and this is what happens with two people, is you can either stress someone else out or you can actually relax someone else.
Yeah.
And that co-regulation happens during a treatment as well. But you can be your own co-regulation.
Yeah.
And,
but what I'm saying is, imagine if I'm already stressed.
Yeah.
And I do this on myself.
Yes.
Will I have any kind of positive impact on myself?
Yes.
Yes.
Because although you might start stressed, right, and you'll have a certain energy, it's intuitive and it's also almost immediate that the second you start stimulating this point, that reflex, you're communicating with your nervous system that you're safe.
Okay.
And you just immediately relax.
Yeah. Okay.
And everything starts to drop. And so you are more regulated then.
I'm a big believer with energy and how a person's energy could impact me. So a lot of times, not a lot of times, okay, sometimes I would go to get a massage.
Yeah.
My intention is to feel better and to feel good. But sometimes we're all humans, you know, sometimes people can go through stuff having that negative energy. So some people would give me their energy. So I feel when I go out of the massage or whatever treatment, I feel more heavy.
Yeah.
So that's why it's very important. Like you said, you have the intention for that person to make them feel better. So it's
Yeah.
always about that energy that you give.
100%.
Yeah. So if someone's energy is filled with so much negativity, and a simple touch
Yeah.
would give you that negativity in you. So
Definitely.
yeah.
I mean, there's a reason why, like a lot of monks and things, they don't hug.
Okay.
Because a simple hug is an exchange of energy.
Yes.
And we're constantly exchanging energy.
True.
So in that sense, I do think you need to find the right therapist. And
Exactly.
it's a reason why I don't necessarily love the idea or the concepts of Reiki, because I've got to really, really trust your energy to do that.
Okay.
Yeah.
Okay. Is there any, you said you have so many other examples of clients. Would you mind sharing another?
Yeah, sure. So actually, one of them is very close to me, my sister.
Okay.
She's got endometriosis, and that is something that has zero cure, and you are struggling all the time. She's also on high cortisol
Okay.
constantly, and she's someone that I've worked with over the years, and just stimulating certain points and regulating. She's experienced a huge shift in her endometriosis in general, but also in her mental health. And that's something that it really works well on. Physically, it works really well, but I find that more mental health related, it works exceptionally well. And especially when it comes to sleep. I have another client who is an insomniac, could not go to sleep before 2, 3 a.m., like impossible. And we got them to do the 21-day protocol. So this is something that I have online. You just download the guide and you follow the points yourself at night. You do it for 21 days. And
do you need a specific tool? Because I see you use a tool, or
I
can
do
use fingers?
use my tool. You can use the tool, and they are easy to find, but you can, and this is what I love about it, you can use your fingers, you can use a chopstick, you can use a pen, whatever you feel comfortable using on your face.
Okay.
You can use. You can use the tip of your makeup brush. It really doesn't matter.
Yeah. Okay, interesting. Nice. So you mentioned about the cortisol with your sister. So it does make your cortisol level also go down. So it will improve a lot of things.
Yeah. So because of that direct communication with the nervous system, that's what we're focusing on. So it's more, and that combination of like mindfulness that I do as well in a lot of my guides with the reflexology. We're working on giving you a tool, because sometimes, in most cases, it's nice for people that struggle with cortisol and just the ability to slow down, which is something that we struggle with in today's world, is just bringing ourselves down for a second, is giving yourself a tool. Because sometimes the concept of just sitting still and meditating for 5 minutes is not what people want to do. So having that sort of physical element to it is really helpful. You're communicating with your nervous system. So instead of being in that fight, flight, freeze mode, you're able to regulate, bring yourself back to rest and digest. And that's where the healing actually happens.
It's very interesting to see how you can heal something from something.
Stress.
Yeah. Stress is something huge.
It's huge. The silent killer, right?
Yes.
Yeah. And I think because you can't see it.
Okay.
Yeah.
So I wanted to ask you this thing. I know it's been a hype or a trend that people use, like, you know, the Jade rollers or the gua sha. Is it the same concept of the facial reflexology, or this has nothing to do with it?
No, they're completely well, there's some overlap, but they are completely different. Where the Jade roller, I do think, is a little bit of a fad.
Okay.
It's sweet in some cases, like if you're doing a treatment and you just want to go over the end with like a frozen jade roller, it's nice and cooling on the skin. But we're not really doing anything there. With gua sha, it's great for like muscle and fascia release, and it's great for lymphatic drainage.
Okay.
But we're not working on the nervous system. If it has that bonus of it relaxes you, then it is.
Okay.
But facial reflexology's main thing is actually communicating with the reflex points and the nervous system regulation.
Okay. Is there since you said it's something very old and ancient from the back days, so is there any clinical research that supports this kind of practice, or enough research or science
Yes and no. There's definitely science behind it. And in the same concept that there is with acupressure and with acupuncture. But not a lot of funding will go into studies that don't produce profit.
Okay.
So it's like, in the same sense that there's not a lot of factual science behind the benefits of a green juice or the celery juice movement. People have experienced it and people benefit from it. But when you can't make proper profit out of it, there's not going to be a lot of backing behind it.
Okay.
And it can be associated very much with woo-woo and like hippie type stuff. And it's something that the positive side is you don't have to believe in it. You can try it, and if it works,
works. If
great.
it doesn't,
Exactly.
it's not going to harm you.
Yeah.
Yeah. But I also believe if you believe this thing would make you better, it will make you
Yes,
better. You know,
yes.
as simple as sometimes when I would give an example, if you have a headache, you would take like a Panadol.
Yeah.
If you say, I will take this Panadol to make me feel better,
Yeah.
it will make you feel better.
Yeah.
And if you say, it will not do anything, so you'll take it and it will not make you feel better.
Absolutely.
In some cases, it will happen. So it's a lot of the mind, how
Yeah.
how would you react to things would make you.
And how incredible that the mind has that much
Exactly.
power.
Exactly. So yeah.
It works both ways. Definitely. My mom actually had this thing where I was saying about kids and when I was a kid struggling with IBS. So she would do this thing where she'd say, should I whoosh, whoosh, whoosh it? And she would literally place her hands, not touching, but just over my belly and say, whoosh, 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 guiding it out.
Nice.
And instantly it worked. And that's just like the power of the mind. Obviously, I was a kid, but it worked.
Yes.
For me.
Yeah. You know, actually, you just said this. So sometimes I do this when I'm in a place that a lot of negativity could happen. So, or any like news that I heard that affected me. So there's this thing I do. It's simple. I learned it from someone that taught me that. So I do something that's just this to cut off any negative
Love that.
energy. It's just a thing that I do.
Yeah.
And I go alone and just like break this and shield myself again. So it's just a simple thing. There's nothing voodoo with it. So it's just you believing that I am taking it away, putting the shield back again and having that positive thing again. So it makes sense. Like, you know, when they say moms know everything.
Moms know.
And so it's just like whoosh, whoosh, whoosh. You said that. And she made you feel better. So
and we joked about it at uni as well, because obviously I had my first panic attack at uni.
Yeah.
And she was like, do you want me to try the whoosh whoosh? And I was like, you know what? Go for it. At this point, it worked.
It worked. It's amazing how much,
It's good.
Yeah. I want to talk about the clenched jaw.
Oh, yes.
Yeah, can we get into depth about it?
Sure.
Why does it happen from the first place?
Well, the clenched jaw is a little bit of a trauma response. So this is deep. Okay, we've got a few things here.
Yeah, okay.
So we've got the initial just trauma response, and you're grinding your teeth. You're just really stressed. And so at night, generally, that will manifest as either grinding or just clenching.
Okay, sorry, before you continue, I just want to, because I know in this world right now, the word trauma is going a lot. So everything would happen to you, people would say this is trauma.
We're traumatized.
Yes, we're traumatized. And I think people are misusing this word so much. So when you say a trauma, what do you mean? How big the thing could be? Could be simple as stressed or an actual trauma?
No, I think it could be anything that stresses you out. And maybe that is why the word trauma is getting misused so much, is because the brain sees big and small stress exactly the same way.
Okay.
And that's just how it interprets it. So whether that is your boss is calling you and you don't know why, that can stress you out for no good reason. Or whether it's that, you've had an accident or something and that can stress you out, or you've undergone surgery.
So your mind doesn't know the difference between small and big?
No.
Okay.
And that's why the fight-flight mode is so relevant, is because I'm sure you've heard this as well. You go into fight, flight, or freeze mode when you think you're being chased by a tiger. But now that tiger could be your boss. It could be traffic. It could be anything. And it's bringing yourself back out.
Okay.
That's what matters. But
Okay.
also building resilience so
Okay.
that you're not traumatized by everything.
Yes. Okay.
But, you know,
Yeah.
you can build and face those stresses
Okay.
more easily.
Okay. So
So, yeah.
yeah,
So
let's
with
continue.
the jaw,
Yeah.
there's that aspect, is that it's just an initial response. But then there's also, it could also be like structurally dental. So that's one aspect. It's a very small aspect because usually if there's something wrong there, you would know and you would have had that checked out at routine checkups. With facial reflexology, we associate it with hip and lower back issues. So that's
Okay.
the reflex point there. So if you struggle with any hip issues or tight hips especially, which a lot of people do, then it can result in a more...
How is it related though?
That's the reflex zone.
Okay.
Yeah. So that's just naturally where it is. And usually when we start opening up and working on the jaw, it will naturally release a little bit more with your pelvic floor and just your hips in general,
Okay.
and vice versa.
Okay.
So when you work on certain stretches for the hips,
It will release this.
release the jaw a little bit more. Yeah.
Okay.
It can also be related to, because your jaw is connected to obviously your neck as well, and with posture and just being on screens all day and just looking down. I mean, the head is such a heavy weight that if we're not adequately strengthening our bodies and moving them correctly and gaining that muscle to come back and use those back muscles, then we're putting a lot of stress here.
Okay.
And so that naturally would just cause a lot of buildup around the
Okay.
jaw area.
Okay.
Yeah.
I've seen videos of how you would release this area.
Yes.
So would you mind explaining? Is it something that's painful?
Well, if you go to a physio, it could be. I went to a chiropractor to get mine sorted, and they just go straight to the joint.
Okay.
And
so it's from outside or inside?
Yeah, from inside and outside. So you'd put your thumb up, and it's not around your throat area. You can even close your teeth, and it's in the cheek.
Okay.
And it's at the jaw. And then you'd use the outside fingers to massage the outside of the jaw, the joint area. But what they go straight to it, and they just apply a whole load of pressure on until that radiating pain eases. But then you're in pain for the next few days.
Okay.
It works. It's just different. The way we tend to do it, or facial therapists that offer like buccal treatments or just jaw intraoral treatments, they do it much more gently.
Okay.
And we're still working the same area, but it's just a much more pleasurable experience. I mean, I've had people fall asleep.
Yeah.
Yeah. And
It's a good sign when someone falls asleep and
absolutely.
Yeah.
I love it. It's like I've just got a little award.
So like let's say you wouldn't get offended if someone falls asleep
No, and
during...
the thing is, people apologize for it all the time, and I'm like,
Yeah.
you don't understand. You've just told me I've done an excellent
Yes.
job. Thank you.
Yeah. It's such an
Yeah.
amazing feeling to fall asleep
Yeah,
during a treatment like this.
definitely.
Yeah.
And especially with someone's hands in your mouth. I mean, that's a whole other level
Yeah.
of trust, you know,
Yeah.
and that's such a nice sign.
Mm-hmm.
But that's also that just tells you how relaxing it is, because we have like over 47 facial muscles in our face that never really get touched. And so that's something that I like to work on a lot, is just releasing those muscles.
Okay. Mm-hmm.
Yeah.
How does a typical session look like?
So a session, if we do the reflexology session, we'll always begin with lymphatic drainage. So we're really opening up the ducts. And then we go into certain acupressure points to just get that energy flowing. Then we work the reflexology points and start actually working on the client's individual issues. So it's very personalized.
Yeah. So if I would come to you, and do I have to have an issue to come
No.
to you? So what type of clients that would come and book a session for a facial reflexology?
Okay. Literally anyone. So like I said, I have a 5-year-old and I have an 85-year-old and everything in between, because there's no limit to what it can help. But usually you'll feel the most, you'll have that drastic before and after feeling if you have something wrong with you.
Yeah.
But
I do believe everyone has at least a stress going on in their life.
Yeah.
So it could be something minor,
yes,
but you would feel a difference if you get it.
definitely.
So you don't have to have, like, let's say, digestion issues or gut issues, but yeah.
You just might be generally stressed.
Yeah.
Yeah.
You need some relaxation, an hour off just for yourself.
Yeah, absolutely.
Yeah.
Or you're just, pre-menstrual, or you started your first day of your period and you're like, you know what, I just need something to
Okay.
just relax today. But even if you're generally the healthiest person and you don't have any mental issues and you don't have any physical issues and generally you feel tip top, there's nothing wrong with maintenance.
Mm-hmm.
And it's like, this will only help you continue feeling your best.
Yeah.
So it's good
It's
for
like with
everyone.
everything. Like, let's say if you don't have to go to a physio, let's say if you're someone that strength trains,
Yeah.
you don't have to have an injury for you to go to physio, let's say.
Yeah.
It's something like you said to maintain.
Yes.
Or let's say also with training, you don't have to be in pain with weakness so you
Yeah.
can start the gym. So you have to maintain those kind of things for a better
Yeah.
physical and
Definitely.
mental being, yeah?
And usually, if we prioritize ourselves well enough, then we will see that.
Yeah.
But for the average Joe, it's usually a matter of they need to feel something wrong first before they think,
Yes.
I need to do something about this now.
I think that's just how human beings react to stuff
Yeah.
with general things. Like they wouldn't cut off, like I say, sugar or bad habits until something would go on with like having like diabetes or pre-diabetic, you know?
Yeah, definitely.
So it always has that they need some kind of like a shock
Yeah.
that would make them realize, oh, I need to do that.
I think it's the concept of why fix something that isn't broken, right?
And I've mentioned this so many times in lots of podcasts I've done. Us as human beings, we don't focus so much on things that we cannot see.
Mm-hmm.
So let's say we would focus so much on getting the best facial, doing like the best things to our hair, nails, skin, body, but we don't focus so much about what's going on inside because we cannot see it with our own eyes.
Yes.
So when you see some kind of tests that you've done that would say, oh, you have high cortisol levels or you have something wrong with your sugar levels.
Yeah.
And then that would be a shocking for us. And that's,
definitely.
Yeah.
I don't know if you've heard of the Aura Ring.
Yeah.
Okay.
Yes.
So I feel like that's been something interesting that's come about to really show you the effects of the unseen in a sense.
Exactly.
And I love that because finally we have a metric.
Yeah.
You know,
I think it's similar to the Whoop.
Or the Whoop? I haven't heard of that one.
The watch, the Whoop that gives you like your recovery.
Oh, yeah, probably.
Okay. Yeah. So the Aura Ring is more in depth with stuff.
Well, it's more that it tells you when you were stressed. So let's say you went to a family gathering and it's suddenly telling you on the app, like you are super stressed right now. You know at least that is a trigger for you.
Okay.
And not that necessarily you have to do anything about it, but even just being aware of it and being mindful of what is causing you stress. Okay. Yeah. Because then you know, okay, maybe after family gathering, I'll do some reflexology.
Yeah, you have to have such a good response to it, though.
Yeah.
Some people would just might make them feel even more stressed.
Yeah.
That, oh my God, I'm not sleeping well. I'm seeing that my recovery is not well. I'm stressed when I'm doing this and that and that.
True.
So yeah, it depends on the person, but I completely agree that if you be so mindful about if this kind of situation makes you stressed, you should do something about it.
Yeah, ideally.
Yes, definitely.
Now you know the system's broken.
Yeah. You know, actually, I would... I'm very mindful about how things would make me stressed. So I'm not a smart girl watch or anything that has, these kind of things. So I don't wear watches. I used to.
That's so refreshing, by the way.
Yeah.
I see everyone wearing those.
I hate that hype. And it's just what made me not wear it anymore because I don't want to wear such things because I feel like it doesn't...
Constantly connected to something,
right? It disturbs me.
Okay.
So what happened when I first started my podcast, you're nervous, cameras. So I used to see my heart rate so up. Oh. And it's only normal for you to feel a bit anxious, nervous, my first thing to do. So when I see my heart rate is 140, I get even more panicked that my heart rate is like that. So, and then I decided, okay, let me just not wear the watch and not see my heart rate.
Yeah.
And it worked wonders. And
definitely,
I feel so much relaxed.
Yeah.
So sometimes, it would make me feel aware that, okay, this kind of things stresses me out, but it's only normal for you to feel nervous or...
Yeah, when you're out of your comfort zone as well.
Like, it's something you're new to this. But
Definitely.
if you're doing this for such a long time, خلاص, you're like,
So don't check the Aura ring
Yeah.
when you're in a family gathering. Check it
after.
afterwards.
So you can, but yeah, of course, it depends from one person to
Yeah,
another.
no,
Yeah.
definitely. I agree because I think, anyone who struggles with like high blood pressure,
Mm-hmm.
and they're getting their blood pressure checked and it's not going down and the doctors are there and you can't leave the hospital now because you need to wait for your blood pressure to go down. Now it becomes a thing,
Mm-hmm.
that before it wasn't. So
Yes.
you're like, okay, well, it's not going down. Now I'm getting even more stressed that it's not going down.
بالضبط. Yeah,
And it's
exactly.
like, it's a never ending loop.
It makes you stressed even more.
Yeah.
So yeah, sometimes in cases
Hit and
it's
miss.
better not to know
Yeah.
when your heart rate. And
I
I get a
agree.
lot of clients like, oh my God, my heart rate is so up. I'm like, it's okay, you're training.
Yeah.
You're doing some form of exercise. It is okay for your heart rate to go above 100.
Yeah.
So don't get stressed. It's not something
And that's it. It's about building that resilience.
Yes,
Yeah?
yeah.
So it's like you keep doing the things. There's certain things. And again, I think this is where like common sense comes into it as well, is reading that and finding that balance for yourself and knowing intuitively. And it does take self-awareness and it is a muscle that needs
Yeah.
training. But generally, like you need to know what works for you and build that resilience as well.
Okay.
So, like you say with the strength training, it's something new. Does it mean you don't come back tomorrow? No, it just
Yeah.
means that we build that muscle.
True.
Yeah.
Okay.
And that goes for mental health too.
Yes,
So
exactly.
find those quiet moments. And even if it's uncomfortable,
Yeah.
just keep doing it.
Okay.
Yeah.
You mentioned just a bit ago about you getting this type of treatments on your first day of period. Is it fine to
Yeah.
get it while you're on your period? Because
Yes.
some girls are sensitive, or let's say some treatments that are not suggested to do it while you're on your period. So would you mind explaining if it's fine for someone to go do it on your first day of period, whether you have endometriosis or PCOS or any hormonal issues?
Yeah. As with most things, it's what's comfortable for the individual. If you generally are fine, like I know some people that are like glued to the bathroom on the first day of their period, they just cannot function. Or with endometriosis, you just might be completely on the floor, bedridden with pain. So I would say in those situations,
It depends on the person.
Yeah, it depends on the person.
So, I mean, there's no any
No.
negative impact on someone that's on
It
their.
will only be helpful.
Okay.
It's just, can you lay down
Okay.
and relax,
Okay.
or not? Like physically,
Yeah,
are
yeah,
you
yeah, yeah.
okay to do the treatment?
Okay.
But in other areas, absolutely, it's so helpful. And in a lot of cases, because it reduces inflammation, it helps the flow of blood as well.
Okay.
And it just helps all the symptoms.
Okay.
Yeah.
Would you suggest to do this alone as a daily thing?
Absolutely.
Yeah.
Yeah. I would recommend this to be, because it can be so bite-sized. It could be a 5-minute practice. And if you do that, like it's building that habit. Find the time that works for you. I'm a morning type of person. But if you struggle with sleep, or if you find that just at the end of the day, that last few minutes in bed, instead of scrolling, because we all know that's happening, just do this for 5 minutes.
What can they do?
They can do a full face map.
Okay.
That's, again, I just created face maps because they're easy to follow.
Okay.
They have just literally the points on the face.
Where you have to do it.
that
And it
you-
takes how many minutes?
under 5 minutes.
5 minutes.
Yeah.
And it just becomes a habit
It becomes a habit.
if you do it every day.
Yeah,
Do you
and-
do it every single day?
I don't.
No.
No, I
Okay.
don't. I would love to say that I do, but I'm human.
Yeah.
And then there are moments where you're just like, I cannot be bothered. But I do it most days.
Okay.
And I try to stay true to that. And I try not to miss the 2 days. I find that that is a sweet spot for me. If I stop doing whatever habit I'm trying to build for 2 days in a row, I know that it's going to go. And so I try to, if I miss one day, that second day, I'm doing it.
Oh, okay.
Yeah.
Would you see the difference if some days you skip it in general, or it's just something it's just something that you wouldn't see effect directly?
It depends on the thing that we're targeting. If
Okay.
we're doing mainly mental or in general, when you're practicing it, whenever you practice it, you're going to benefit mentally and emotionally from it. Nervous system, you're going to come back out of that and you're going to relax. But if you're working on, let's say, PCOS,
Yeah.
or something a bit more physical,
Mm-hmm.
then ideally you want to stay very consistent with that and do it over 21 days.
Okay.
Yeah. So we have a 21 days, a 7-day break, and then again 21 days.
Okay.
Yeah.
Okay. What are the most misconceptions, myths about facial reflexology?
I think one, that it doesn't work. Well, that's the kind of main thing, or maybe not that it doesn't work, but it's a face massage. I think
Okay.
that's the thing I get the most.
Yeah.
Is this a face massage? Can I book in for a facial? And I
Mm-hmm.
say, I don't do facials. Like, I'm not going to extract anything.
Mm-hmm.
We're going to extract bad emotions, but we're not extracting anything else. So that's probably the main thing that I do get. And then the other thing, like I said, is will it work? Or maybe this won't work for me, you know? And I say the same thing again.
If
We can
it's-
try it.
Yeah. If it doesn't, it
Yeah.
won't harm you.
It won't harm you. If
Mhm.
nothing else, we stimulated blood flow and you look great,
Mm-hmm.
you know? And I think that's the thing with facial reflexology, going back to what you said about you can't see the benefits, or if you can't see it, then you tend maybe to not do it.
Yeah, yeah. And in this generation, we always tend to want something very fast.
Yes.
So it's either I do get an effect right now,
Yeah.
or I won't do it.
Exactly.
So sometimes you need time for you.
Yeah.
Like let's say supplementation and good food. You don't see an effect. Okay, you might see like let's say if from the first 2 days you cut off sugar and eat well,
Yeah.
you would see some sort of difference.
Yeah.
But in general, with supplements and you
And
don't
it takes
see it. Yeah,
time.
it takes time for you to see that difference because
Yeah.
we live in a fast world right now. We want everything so fast. So
Yeah.
people are not patient with the results they would get benefits from it. Yeah.
And then they write it off like it didn't work for them.
Yes.
But it's like, that's why I say 21 days. If you haven't done it for 21 days,
Yeah.
then you can't say it hasn't worked.
Okay.
Yeah.
Okay. As another misconception that I might feel people would ask, does it hurt?
Facial
Yeah?
reflexology. No, it's never painful. At most, some points that are really screaming at us to work on can be tender or a little sensitive to the touch. Mainly for most people, that's the liver area. Then something that you can actually do yourself is when you like press in on both sides, and on the right side under the cheekbone is the liver. And most often, I'd say in 90% of my clients, they feel that point.
Okay.
Because the liver does over 500 things for us, and it's very overused and mistreated, I feel. So extra TLC is always needed.
Okay. So it's not a painful treatment.
No.
It should be relaxing. In other words.
Very relaxing.
Okay.
Yeah.
Okay. Lastly, before is there anything you want to add in terms of?
I feel like what I'm about to say is
Yes.
probably your next point about castor oil.
Yes.
Yeah. Okay.
Yeah. So I know.
Yeah.
It's been going on, or I think it's something worldwide.
Yeah.
About the castor oil, putting it around your belly.
Yeah.
Would you mind explaining what does it do and why? Who
Sure.
can do it? Why?
Okay. Well, castor oil it's an age-old remedy. I mean, most of our grandmas have mentioned to us about castor oil, so I feel like there is wisdom there. Is it necessarily as much of a quick fix as a lot of people these days are saying it is? Yes and no. I wouldn't say it's a quick fix. Can it heal and penetrate and do a lot of good for your body? Yes.
What can it do?
So it has a property in it, which I actually can't pronounce. It does have a property in it that is known as an anti-inflammatory.
Okay.
So what you do is when you apply it topically, it seeps in to your through your skin, your largest organ, and it will penetrate through to your bloodstream. When you apply it on certain areas, it's said to penetrate through to those and go directly to those areas. So when it comes to any hormonal issues, if you're applying it over like the ovaries, for example, then it would directly go through there. I myself and a lot of people have experienced cysts decreasing in size. And this is something that has also worked with breast cysts as well for a lot of people. It can be used for hemorrhoids, like topically applied, and that really is helpful as well. And then the liver.
Okay.
That's probably the most used form these days is for liver detox.
Okay.
Yeah. It's more that it is a anti-inflammatory oil in its nature, and that is what's facilitating like the healing process.
Mm.
I think there is a little bit of a hype, but I do think there is a lot
There's
of truth to it.
benefits.
Yeah,
Yes, yes.
yeah,
So
definitely.
do you? I know that you do you do that as well?
I don't offer it as like a service, but I do it myself.
Yeah,
Yeah,
you do it yourself. That's what I meant. Yeah,
Yes.
you do feel any difference?
Yes.
And yeah,
Yeah, especially if you're talking about stomach issues, bloating,
yeah,
it's almost immediate. The people that shouldn't use it is, for example, and this is something that is harmful with information on the internet, is they don't give you all the information that you need. So for castor oil, some people are like, it's really going to help my periods. So I will do it during my period as well.
Okay.
And it's like, no, actually do not do it on your period.
What would it affect?
It makes your blood flow much heavier. And so if you also struggle with painful periods, that increase in blood is going to worsen the cramps.
Okay.
So avoid it from day one till the end of your period, but definitely do it before the period because that's going to help.
Yeah, yeah. I know lots of people that that do have cysts.
Yeah.
That it did shrink
Yeah.
so much when they applied the castor oil. And you said earlier about your mom doing this thing. So I remember now it made sense because when we were kids, when we were kids, if we had any stomach issues or pain or gases, our moms would always come with castor oil.
Yeah.
And just
And actually
rub
massage it.
massage it. So we thought it was just a thing by that time. But now it makes sense when things come back as a trend. But it's actually
it's because the Western world has cast its light on it.
Yes.
But this has been around and used, and especially in Ayurvedic medicine, it's been used for centuries. So it's the wisdom is there. Unfortunately, it takes the Western world to make it a trend for it to have real light shed on it.
Yeah, and it just amazes me because some people would, when you think about you put an oil on top of your skin, how much it goes through your bloodstream.
Yeah.
So can you imagine the power of that? So when you think about it, when you use chemicals in our body, how much would it absorb it?
Oh,
And
how much
like you said,
time do we have right now?
So yeah, it's just amazing because people are not aware of the bad products and the toxic products that we use on our skin, face, hair. It all goes through our body, even like as simple as like let's say the pads that we use.
Yeah.
So it's let's say it's not just something that we say you have to use organic, because it would make a difference because these things go through your bloodstream and it would affect on so much things. So imagine a simple thing, a castor oil would make your cyst shrink or make your periods better, not painful.
And I think when you see these connections, and you see and you actually acknowledge, because I think a lot of people don't recognize that your skin is your largest organ. You just don't think of it as an organ itself. When you think of the liver and the kidneys, and you think of these things as internal.
Yes.
And then the skin is actually on the outside, and it's taking on all of this, the perfume and the shampoo and the body washes and deodorant, all of these things. It's just taking in and really trying hard to keep you going optimally. And then we add in things, that get injected onto our skin and into our skin. And that's a whole other side of the problem.
Yes.
Yes.
What advice would you give to every girl going through like stress and any issues with her digestion, sleep, and like just to finalize this episode?
Sure. I mean, predominantly, I would say,
especially as you, when you were a kid, you said you went through anxiety so much. So
yeah, it's really, it all gets better. I think that's something. And in that moment, you really think that you are the only person going through something. Whereas when I actually had the courage to speak out about it, and even just to my immediate family and friends, and just talk about it, and I realized how many people, different ages and different people and from different countries, are all experiencing the same thing. In one way, it made me feel much less special.
Yeah.
But in a lot of other ways, I was like, okay, this isn't just me. I'm not in this alone in that sense. And there's so much you can do for yourself. And if you just literally scrap all of the noise and just go back to the basics, are you eating color? Get color on your plate and not Sour Patch, like actually good, grown from the earth color. Are you moving your body? Just if you're overthinking, move your body. and then just find one thing that you enjoy to do for your mind. That could be facial reflexology. It's something new. It's something that really works. But if it's not that, find something that is that. Find, is it art? Is it clay? Is it dancing? Whatever it is, just find something that feels good to you.
Amazing.
Yeah,
It's just so nice to hear all these.
definitely. It's so nice to
Yeah,
speak to you about
yeah,
it.
you too. It felt so casual and
Yeah.
like an hour or so just talking about this. And I hope lots of people would have an eye opening on things to realize that they
Yeah.
need to work on stuff.
They need to work on stuff, but also don't complicate it.
Yeah.
Yeah.
Don't overthink.
Don't overthink it. Just go back to basics.
Yeah.
Yeah.
And it's very simple.
Yeah, definitely.
Yeah.
Okay, lovely.
Thank you so much for
Thank
coming.
you.
It
It was
was really
lovely.
nice meeting you in person.
Same. It was
Thank you
gorgeous.
so
Thank
much.
you.